Welcome to The Age Guide, the podcast where we give voice to older adults and caregivers, challenge ageism, and offer guidance to help you thrive on the journey ahead. I'm Gretchen Knowlton, your host, exploring the policies and ideas transforming the aging experience. This season, we're diving into what it really means to age well, from staying connected and keeping our minds sharp to raising awareness about age bias and strengthening the systems that support healthy aging for all of us. Today's conversation is one I'm especially looking forward to. We're joined by Kris Geerken. Kris is a dedicated advocate for health equity and social justice, driven by a vision of a world that embraces people of all ages, abilities, and identities. In her work with Changing the Narrative, she helped raise awareness about the impact of age-related stereotypes and discrimination, where she developed the Age-Friendly Healthcare Champion and even produced the short film Antidotes for Ageism. I'm so excited to have you here today, Kris. Thank you for joining us.
Thank you so much for having me, Gretchen. It is great to be here, and I'm excited to connect with your audience.
This is a great topic for our Healthy Aging series. And you bring, obviously, the years of experience working at that intersection of aging and healthcare, hospice, and ageism advocacy. And now you're completing the gerontology program. With so much happening in your life, what's the project or initiative that you're most excited about right now? Or a couple of them. I'm sure it's hard to narrow it down to one.
Sure. No, thanks for asking that. Yeah, what I am working on while I'm a grad student at Virginia Commonwealth University is a research project. And I'm so grateful to have the opportunity to do this research. And I have like a theory or hypothesis that I will address in this research project this semester, where I'm going to take a look at ageism, ableism, and those beliefs that we may have that are ageist and ableist, and how they potentially correlate to grief and loss. And I want to find out what those correlations are. And grief and loss are topics that we shy away from in our culture, our society, where, we don't really even make the space for people to grieve when they've had a significant loss or death in their families or in their life, right? And you
Right.
can
We're
get,
uncomfortable with that.
yeah, and you maybe get 3 days off from work for grief, you know, care. And obviously that's not enough time to like cope and move through. Grief is a process, like aging is a process, right? We are experiencing it throughout our lives. And grief, too, if it's not respected or seen with reverence in the way it is in other cultures, or, where we may have ceremonies or just different elements that bring this awareness that we need to take time to nurture ourselves and care for ourselves and like feel through, what it means to have lost this person or something significant. So there's there's so much to it, but I really feel like there's something missing in the ageism and ableism awareness that might correlate to grief and loss. And I'm just trying to figure that out.
It's hard for us to even maybe start a conversation about that grief and loss sometimes. We don't know how to talk about it, or maybe we're uncomfortable about it, or we're scared that we're going to say the wrong thing, or maybe we're suffering some of our own grief and loss, and don't know how to express that to others. So you also mentioned that we don't really understand that well, how ableism and ageism show up. And I think we might need to just take a moment to kind of define what those things mean. Would you be able to define ableism and ageism for us?
Sure. Yeah. So ageism specifically is when we have assumptions, stereotypes, generalizations based specifically on chronological age or even generations, or age groups. So if we say like, oh, all younger people are lazy, that's an ageist statement, and
Mm-hmm.
it's a generalization, and it's just not true because you're not looking at each individual person. And then ableist, um, the definition of ableism would be when we make um, assumptions and stereotypes and generalizations based on someone's ability, whether it's a physical disability, just a cognitive presentation, a physical presentation, behavioral, and we stereotype a person based on those things. And um, also, when we think about disability or abilities, um, lots of them are invisible to us, right? And so if we make statements like, oh, that person is, quote, crazy, or, stereotypical statements like that,
Mm-hmm.
we don't know what anyone is living with, and just because you see a person maybe standing in front of you and they appear to be healthy, it doesn't mean anything. There could be all kinds of internal challenges, physical challenges, emotional challenges, mental challenges. So it's making assumptions about someone's functionality or their abilities, and it's harmful. And then what becomes problematic and what's not been researched well is the misperceptions about aging and abilities. And lots of people make assumptions that older age means becoming disabled in some way, right?
Mm-hmm.
And the first thing that comes to my mind when I hear those statements, I think, well, first of all, like no one knows what the future will bring. You don't know if you'll have any type of disability just because you're an older person, because
Mm-hmm.
there's plenty of older people that we know that have no, quote, disability, right? And also at the same time, when we think about disability, it doesn't necessarily mean it's negative, right? Like the part of what makes us human is our ability to adapt. And adaptation is such a huge part of living. And we adjust and modify, and, we are able to re reestablish ourselves. Like as changes come into our lives, we adapt to those changes,
Mm-hmm.
and we can, like we have the
Mm-hmm.
capability to do that. And there's
Right.
lots of resources and information out there to help us understand how to live with this new situation or new circumstance, right?
Mm-hmm. Mm-hmm. And that really gets at the whole concept of aging well, which is kind of where I'd like to take the conversation next. And that's the theme that we're dealing with on the podcast this season. But I think when people hear aging well, they sometimes think about maybe living longer or staying physically perfect or being one of those older adults who age and they can continue to run marathons, and we should all be able to do that. And there's a lot of pressure then. There's almost a sense that if you're not completely healthy or you have some ongoing health conditions, you've maybe somehow failed at this aging well. And I don't want to set that tone when I talk about healthy aging at all. And we don't mean to be doing that with the podcast, but would you be able to give us a little bit of a sense what you think aging well truly means? And especially if we shift the focus from like our lifespan to quality of life, are there some insights that you find particularly powerful in shaping this perspective?
Yes, yeah, absolutely. I mean, I've learned a lot just in the courses I've taken at Virginia Commonwealth University on gerontology specifically, then also my work at Changing the Narrative. And if you think like a gerontologist, then you'd understand that across the lifespan, we're ever changing, and it's multidimensional, multidirectional, and we need to think about our aging process, which starts at birth, and we're, until death, we're aging. And what does it look like when you think about how you've lived all the years you've lived to this point in time? It consists of your biology, your psychological state, your social interactions, the environment that you're in, the things that you believe in, your sense of purpose and meaning in life, what drives you, what are you passionate about? All of these things make up who you are. And aging is just something that's in the background that you're just doing as you're living, right? And when we think about aging well, like what I would say, what would you define living well to mean for yourself, right? It's unique to each individual
Mm,
person. So what
yeah.
is it? How do you live? How do you find the things that bring you joy? What brings meaning and purpose to you? And emphasize those things. And it could be maybe right now you don't have something that you feel passionate about or feel a sense of purpose about, but maybe in the past there was something that you did do or you've always wanted to do, and maybe it's time to take a look at that or
Mm-hmm.
revisit it or come back into your life. Just finding the things that really matter to you will give you this sense of I'm living well, which is can be like
Yes.
aging well, right? And without emphasizing that I need to be the strongest person or I need to be like as strong as I was in my 20s or be able to
Mm-hmm.
ski down that mountain. Maybe find some new things if those are the things that are more challenging now, you know?
Right, right. And if you look at aging as a journey, like you said, that starts the day that we're born, then we have lots of chances to kind of reinvent and find out what works for us at different stages of life. And that's okay. It might look very different when we're in our 60s than it did when we were in our 30s, but we can still find and embrace those things that are life giving for us. I like that.
Yeah.
That's a helpful way of looking at it. So, you talk a lot in your work about healthcare.
Mhm.
Why do you think that addressing ageism in healthcare is such an important issue today? How does it affect not only the health and quality of care for older adults, but also maybe intersect with other forms of discrimination?
Yeah, ageism in healthcare is significant. I mean, we know from the Yale School of Public Health, they have done the research on the costs of ageism within healthcare, which they found to be $63 billion annually, which is astounding and shocking
Wow.
and terrible. And why that's problematic for many reasons is that it's preventable. Like we don't have to have
Right.
ageism in healthcare. So we have this high, incredible, astronomical cost, and we don't have to have ageism, right?
Right.
So
We can do something about this.
yeah, so that's why it's important to me, not only financially, obviously, but just that so many people suffer because of the ageism that's so prevalent in our society. And then with it can lead to health problems. Just living in a society that has so many ageist narratives in all aspects of our lives, it harms our health. Like it can lead to depression, cardiovascular issues. I mean, all kinds of things. So that ends up, you know, we end up at an emergency room or a doctor's office. And we don't necessarily know that ageism might be the root cause of these things, right?
Our internalized feelings of our age and where we are in our lifespan can actually affect our health. Isn't that amazing?
Absolutely.
Yeah.
Yeah. And that's why it's so important to me to like help people recognize ageism and ableism right within
Mhm.
themselves and start really when you start to recognize it out there in the world, then you start to see it everywhere. You know, it's kind of like
Oh,
that plant
yeah.
seed, right? And I know
Yes.
like the like ageist birthday cards are the great example, right? Because almost
Mhm.
everyone has seen an ageist birthday card out there, and they've been so dominant in the greeting card industry,
Right.
and it's just makes you feel bad about yourself, right? And
Right.
so when you see those, you and start to question them. Don't just laugh, but think, why are they making fun of getting older? Shouldn't I feel excited about getting older? And shouldn't I feel excited just about the life I'm living? And why would you just paint this one terrible negative picture about that? And that just leads
Right.
to fear and avoidance and denial about becoming older. So that's clearly harmful. And then when we think about just the forms of discrimination, and I like to talk about the social determinants of health and how
Mhm.
important it is to understand that throughout our lives, all of the different identities that we carry could be ones that have experienced different forms of discrimination and oppression in our lives. So,
Mhm.
you know, being female is a form of oppression. Being a person of color, living through poverty, a lack of education, being incarcerated, uh, identifying as LGBTQ plus, like all different identities that any of us could carry at any point in our lifetime
Mm-hmm.
could experience different forms of oppression. And so then when you become an older person, we are so ageist, so you will experience ageism. And I also always like to share that even if you've come from a culture or a background within your family or your people that are not at all ageist and they embrace aging and revere the
Mm-hmm.
elderhood and all of that, our society has ageism throughout it. And so at some point, you will absolutely experience an ageist encounter. So if you can understand and recognize what it is, you can challenge that. Like we all need an ally and an advocate
Mm,
with us. Like
yes.
it is hard if you're the person like I was in the ER last month and thankfully my partner was with me, but I was just, when you're the person on the receiving end of whatever care it is, you're not necessarily thinking clearly or,
Right.
whatever. You
Mm-hmm.
need a person to stick up for
Yes.
and if you are aware of ageism, then you can, speak up when you see it being presented or when you're being
Mm-hmm.
talked down to or whatever ageist
Right.
things happen. And there's all kinds of ageism that happen there in healthcare encounters.
Mm-hmm.
And so we just need to be better prepared and more educated. And it's out there and it makes the care worse. It leads to neglect and people not getting what they need in healthcare settings. It's really rough. So, person-centered care is the way to go. We need that focus on what matters to the patient. What are their values? What type of health goals do they have? And how do we align with that? And, clinicians and administrators of all levels of staff within the healthcare world, everybody needs
Mm-hmm.
better education in gerontology, geriatrics, ageism, and ableism, and it will instantly improve the care, right? If everyone had that awareness, it will change for all
Yeah.
of us.
Yeah, so hopefully conversations like this one that we're having today are helpful. The more we can put this out there and let people know that this exists, that ageism is a real thing and it's affecting us, and we can call it out when we see it. It's not going to end until we keep these conversations going. So
Right.
this is important, right? And hopefully everyone who's listening today is going to take this with them and start to notice, and
Yeah.
that'll make a difference.
Right. And also adding to that, when you think about everybody that works in healthcare and oftentimes, ageist comments come out not with a harmful intent.
Right.
It's just part of our narrative and our society we've gotten used to. But when you start to identify your own self as someone who will potentially become an older person, you think, I would not want to be treated in an ageist way. So, think about how would you like to be treated if you were in that
Yes.
person's shoes? What would I like?
You're right, and that's really good practical stuff, just to think through how you would wanna be treated, and that's all it takes. You know so much about these topics. I in the textbook that you've co-authored, Disrupting Ageism, your chapter is called Ageism in Healthcare. Would you share some details from that chapter that could be helpful for our listeners?
Sure, yeah, and I'm so excited to be able to have been a part of that textbook development and co-authoring it. And from what I know, I don't know that there are any university textbooks on ageism out there at the moment. So I've not come across any, and if anybody does know of any, I'd love to hear about it. But so far, I don't think there are.
No, so this
So,
is groundbreaking, and our listeners get to hear a little tidbit,
yeah,
a little bit of an early release of what went into this chapter, and you can share some of that real world impact that we
yeah.
can make.
Yeah, yeah. So some of the pieces I'd like to share that are from the chapter that I was part of. So we know that there as a shortage of geriatricians in our country, and that we only have one geriatrician or a geriatric nurse practitioner for every 3,000 older adults. And we know that the older adult population is increasing, so that, and there are less people pursuing um, medical practice in geriatrics. So, like, we need more people to be trained. And so, one of the things that's really important, which I would love to see expand, would be training for clinicians and all healthcare workers in gerontology and
Mm-hmm.
geriatrics, in ageism and ableism. And it's not that they have to get a degree in it, but just having some sort of outsourced
Right.
training in these topics
Even
is
a
so
geriatric rotation, like I guess most doctors get a pediatric rotation. It
yeah.
would be nice to
And
see the same thing with geriatrics, but I think the
they
percentages are much smaller.
you're absolutely right. It's like in the like under 10% or something. It's really small. So we need that education and that training for everybody. And when you think about the large population of older adults, whatever type of practice you provide in healthcare, odds are you're going to see older adult patients, right?
Right.
So if you aren't educated and trained in geriatrics, gerontology, ageism, and ableism, you, you know, it'll just help you to provide better care. So
Mm-hmm.
we need programs developed in that area, and we don't have those strongly accessible yet, so that's an important thing. And adopting protocols when it comes to clinical trials, like bringing in protocols that will be inclusive of older adults. We highly need that. Most prescription medications have not been inclusive of older adults in the trials.
Wow.
So, and it's also known that physiologically, as we get older, how we assimilate medications changes. It's just part
Mm-hmm.
of our biology
Makes
as we
sense.
get older.
Yeah.
And so if we have not included older adults in the trials for medications, then we don't truly know how they will impact each individual person. So that's dangerous and also something that we need to address and bring in more opportunities for people to be included. Um, and also something that has just not been well established in our healthcare structures and systems is preventative care across the lifespan. And we
Mm-hmm.
need better programs and access for prevention and education around prevention at all stages of life so that we can set ourselves up to manage older age as best we can with our health
Mm-hmm.
care and know how to set ourselves up to be the healthiest we can in later
Mm-hmm.
life, right? That's a really
Mm-hmm.
significant part of it. And
That seems
then,
to be really tied to ageism as well,
oh,
just or ableism, just this sense that you're getting old, so you're going to have these problems. So we're just going to treat the problem. We're not going to try to prevent anything from happening because you're getting old now.
I know it's absolutely rooted in ageist beliefs and ableist
Mm-hmm.
beliefs that the assumptions that a great example is like a couple of years ago for myself, and I've heard this from other people, other peers. Like I'll be 61 at the end of March, and a couple of years ago I was having back pain, and even though I do this work in ageism, right, and ableism, I at first was like, oh, maybe it's just part of wear and tear and becoming
Yeah.
older, which is also common. Our bodies have wear and tear as we become older. But
Mm-hmm.
to have chronic pain isn't common. It's not acceptable. It's not like
No.
how to live, and something to
Right.
be done about that. But I ignored it for about 2 months, just thinking like, oh, maybe it is just something's getting worn out.
Yeah.
But to have chronic pain is not okay. So I ended up
Right.
getting x-rays, and I found out there's like a disc issue, and it was something that I was able to go to PT for and resolve it. So it's just,
Good. Right.
we need to take our bodies seriously and listen
Mm-hmm.
to them when they tell us things.
Regardless of our age. Right.
Right, right.
There's
And
things
age,
that can be done.
yes.
Yeah.
And so when you just, having the ageist belief that, oh, it's just because of my chronological age and I
Mm-hmm.
have to live with that is not the case,
Mm-hmm.
right? We need to take it seriously. There are people that have answers that can help us,
Right.
and we need access to that too, right? Like making care
Mhm.
equitable for us at every age and accessible. It's so important. And one of the things that I've talked about in presentations that I conduct is with Medicare and like the lack of financial support for vision, hearing, and dental, right? Like
Yeah.
those are crucial parts of our functioning, right? Our
Mm-hmm.
ability to use our eyes in whatever capacity we can, hearing and eating, like chew,
Yes, really
like,
critical.
yeah. And if we can't afford care for those parts of our functioning, then they may end up leading to costly healthcare crises, right?
Mm-hmm.
And that no one should be put in that situation where like they are foregoing care for their hearing or vision or dental care. Um, it just that's not okay with me. Like ethically, I think that's unacceptable.
Yes, yes, we need to change some policies around that.
Yes.
Yeah. Where do you see the biggest disconnect between what older adults need and what the healthcare system actually provides?
To me, what's wrong in that dynamic or what's missing is like
Mhm.
the too many assumptions are made about older adults. It's ageist and ableist, right? Like when we
Mhm.
think about aging and then the healthcare system, there are lots of ageist and ableist practices or beliefs happening and being dismissed. And, many older adults that I have talked with that will say that their care provider has just told them, well, that's what you can expect at your age. And they're just dismissed, right?
Mm. Mhm.
Or misunderstood. So, say you're showing signs of depression, but maybe it's actually grief. And if you're just given a
Yeah.
medication for depression, you're not coping or dealing with the grief or acknowledging that there's grief. So, it's like
And
healthcare needs to become more curious,
mm.
especially about older adults, on like what is going on, what's your history, what have you lived through, what was your childhood like, and like look at that full
Mhm.
picture, take that holistic lens. I really think that healthcare needs to be completely holistic and seeing the
Yeah.
person as this from birth to this point in time on like what has happened in their lives to shape them to be who it is that I'm seeing today in my exam room, right?
Mhm.
There's more to the story than just what's being presented in this moment, and we need to build in the time. I know how pressurized the time is for healthcare providers, and they have like 10 minutes, and it's not enough to
Right.
get to know somebody. So, how do we change that, right? Like maybe
Yeah.
we need to change how we do it.
The healthcare system is such a huge industry and it involves so many things and it gets really political. And it feels like kind of an entrenched problem that can feel a little overwhelming to an individual. Like, how are we going to change this in our lifetimes? And I'm
Yes.
kind of hopeful that with the different generations and the expanding group of older adults, that there will be more public will to make some of these changes because maybe those of us who are growing older and the group of us that are over 60 is going to start to advocate more for this. And maybe we'll be able to move the needle because there's so many of us over 60, right? That's kind of
Yeah.
my hope. I don't know if
No,
that's going to
you're
work, but
I have the same belief. I have absolute trust in that could be the direction we are going to go because it's not acceptable, to be told
right.
it's just your age and to just leave and get no care. And they're definitely learning from other cultures, other countries on how they're doing what they're doing and how can we adapt and modify what we have here in the US is
Mhm.
it's absolutely possible. We can do that. And I'm always inspired when I learn how things are done in another culture or country. And I think
Mhm.
if it's being done somewhere, it can be done here. And so
Right.
one of the things that I've thought about more recently is how, we have our big systems like Medicare, Medicaid, and big healthcare and private insurance through employers, those structures that exist, right? That's what we've become familiar with over the decades.
Mhm.
But I've also seen, back when I lived in Colorado, a provider chooses to go off of the systems and they just offer care as a provider to patient, and a patient would pay a monthly fee to this provider, and then they just pay like kind of a la carte for whatever services the provider is going to offer. And so I
Yeah.
don't know if it's common yet, but
Yeah.
maybe a lot of providers that are getting really fed up with the systems and the bureaucracy and the red tape and all the
Right.
paperwork, it's
Yeah.
become part of their life. They may decide I'm just gonna just find my pool of patients and they pay me a monthly fee and I charge per service, each
Hmm.
item. So that's
Interesting.
something that I know exists, and I just don't know how many people are actually doing it and how it actually
Yeah.
works. I don't know, but it
Yeah.
seems like that's wise, to me. I don't know.
Yeah. But we might have to really think outside the box.
Yeah, and
Right.
another aspect to thinking about healthcare is aside from like, our hospitals and traditional like general practitioners and geriatricians are alternative complementary medicine practices, right? Like acupuncture,
Hmm.
naturopathic doctors, DOs, like doctors of osteopathy, right? Like there's
Hmm.
different types of care that we also can seek that can just support us, our overall well-being, right?
Hmm.
And maybe incorporating more of those. And I know different types of practitioners like acupuncturists, many of them will provide like a sliding scale where you just
Yeah.
pay what you can afford. And
Hmm.
I think there's a lot to be said for, the ancient and traditional forms of care and
Yeah.
medicine that
Yeah.
we could start to pursue and help us just with our overall well-being rather than like
Yeah.
crisis care model, which
Right.
like our healthcare systems are built around a crisis care situation,
Right.
where
So it
it's
gets back to that prevention. Yeah.
yes,
Right.
exactly.
Very good. Is your textbook available if someone is listening and they're going to be teaching a class or they'd like to recommend a textbook to their local university? Where can they find it?
Oh, great. Yes, absolutely. It is available out there through the internet. There's a link that I can share with you all that you could share with your audience
We'll
so
put it
people
in the
can just
show notes.
directly. Yeah, that would be great. Definitely. And if anybody has questions about it, please reach out to me. I'd be happy to share my email so that people can reach out to me as well if they have questions about any of the work that I've been involved with or
Excellent. A
am involved
direct
with.
connection to the author of one of the
Yeah.
chapters of the
Yeah.
textbook. This is
Yeah.
cool.
Okay.
Thank you,
Yeah. I'd
Kris.
be happy to share that.
We like to try to leave our listeners with something that they can take away that they can go do, an action step. So, if you could leave the listeners with one action to take, maybe something kind of simple but impactful, what would it be?
For me, it kind of is like this fundamental thing is just to begin recognizing ageism when you see it anywhere, whether it's in your own thought, thinking like, oh, I'm too old for this, about yourself, or
Mhm.
it's because of my age, or that you see out there in society. When those things pop up or when you see them, challenge it and ask yourself, like, is that the full story? Is that the full picture? Is there more to know about what I'm thinking or what I'm seeing out there in society that's ageist? And what can I learn from that statement or this thought that I'm having and expand it and go in other directions? What do I envision for my own self as I'm aging? What's possible for me as an older person, the life that I imagine, and not the one that society is telling me is all about negative, you know, be young forever. Like,
Mhm. Yeah.
definitely just start to pay attention to where you see ageism and how you can challenge those statements and those thoughts and beliefs because we don't have to buy into that. Like, we have a choice, right? And
Right.
that I want all of us to feel that we have a sense of empowerment and how we believe aging is and how it will be for us and how it should be for all of us, in which we can feel this sense of um, pride and excitement about growing older. Like it's real in many other cultures, and we don't have to buy into the negative narrative that our American society has built around us.
That's really a great piece of advice, and it's so doable. You don't even have to leave your house to do this. You just
Sure,
need to
exactly.
change your way of thinking, which I guess isn't really that simple. It's hard for us to change our way of thinking. So it's a might be a hard lift for some of us, but it's something that's an easy step to take a little bit at a time.
Absolutely right. Like
Yeah.
baby steps, right? When you
Right.
just take the first little thing and just challenge
Yeah.
it. Like when you see the birthday cards, just think like,
Right.
all right, maybe something is funny about that, but at the same time, can I see that it's also harmful, you know?
Yes. Yes. Thank you for sharing that. That is a great wrap up for us. Thank you. And thank you for being here, Kris.
Well,
I
thank
really
you so
enjoyed
much.
talking with you.
This was a great conversation. Thank you so much, Gretchen. It was great to be with you.
Hello, and welcome to your Medicare Minute. My name is Alaine, and I'm the Health Promotions and Education Specialist here at AgeGuide. In our falls prevention workshops, we discussed the need for physical therapy and found that many Medicare beneficiaries are not aware of being able to self-refer. Illinois is one of the states that allows self-referral to physical therapy without a prescription from a physician. The therapist's initial evaluation is a covered Medicare benefit, along with the first 30 days of therapy before reevaluation of treatment is required. The therapist can communicate with your provider during this time to ensure smooth continuation of your treatment. Many times, the PT's evaluation and recommendations are acceptable. AgeGuide offers many exercise programs that can complement your therapy. Visit ageguide.org for more information and on Medicare eligibility, or call AgeGuide at 1-800-528-2000.
Thank you for joining us on the Age Guide, where we explore the insights, experiences, and practical strategies that help us thrive as we age. To learn more about how AgeGuide Northeastern Illinois is advocating for older adults and caregivers, visit us at ageguide.org or call our offices at 630-293-5990. And if you enjoyed this episode, please share to help others find us. Join us next month as we continue to explore what it means to age well.